Wikidonis.com. Truth about tooth.
Hi, I am Dr. Thomas Nejipadam from Nejipadam Dental at Kerala. Today we will talk about something interesting. It's all about gums. The pink in the smile. We've been talking about smile designing in a series of this thing. We've been talking about the lip. We have been talking about the tooth. Today we will speak about the gums. That is actually the part of the smile. Actually the lips, the gums and the tooth makes the smile really well. So today we will speak about the gums itself. The major concern of most of the people who are having a gum issue in smile is actually gum visibility. When they smile, they see a lot of gums, or the tooth to the gum ratio is less. The easiest way or the simplest of the problem is actually the gum covering the tooth, a lot of the tooth structure. The tooth crown itself is very short, or a short clinical crown which has a gum which is covering into it. Maybe it is because of gingival hyperplasia. Why does a gingival hyperplasia come? It may be because of a previous orthodontic treatment. It may be because of some medicines you are having. Maybe it is gingival inflammation itself. The gum which is inflamed because you might have not got for a professional cleaning of tooth. Maybe that is the reason why the gum has grown into the tooth. In such cases, which we can actually do a gingivoplasty. Whenever you hear about a plasty, it is a small reduction of it. It's just like you might have gone to a beautician and gone for a nail correction because you want your nails to look longer. Just like that, where like you remove the cuticle of the nail, we also remove the gingiva which is excessively covering the tooth. That will actually sometimes we can take up to 3 millimeters of the gums from above the tooth. So if you think that okay, you have only 5 millimeters of tooth which is visible and 3 millimeters of the gum is actually coming, so we increase the tooth's length by around 30 to 40%. That's a lot of length, because even if you say that it is 3 millimeters, when you think generally 3 millimeters is nothing, but when it comes to the smile arc and things like that, 3 millimeters is a great change. So the simplest of the treatment and the simplest of the problem is in the gum visibility is actually a gum which has grown into the tooth, and that can be corrected with gingivoplasty. So second part to it is actually the color of the gum. There are people who are especially dark complexioned, having very dark gum or black gum. So we can actually do something called as a gum depigmentation. How do we do a gum depigmentation? The gum depigmentation can be done with a laser. That is the newest technology, wherein we just take the melanin pigmented cells, we just blast it off with laser, which is actually a soft tissue laser, which is not at all painful or anything. We just use a laser so that the black cells will take the laser first and it just blasts off. So that is a laser guided gum depigmentation correction. The other conventional technique is actually to do a gum peel. Just like you do a skin peel, you might have gone to the beautician once again and then gone for a skin peel to have a better skin and things like that. Just like that, we can also do a gum peel using some abrasives. Sometimes we use a scalpel and things like that according to the thickness of the gums. So that also will give. So these are the two ways how to make sure that the depigmentation stays, because most of the time if you do a depigmentation it comes back. So what should we do to avoid that? So you should not use anything which is very harsh on the gums, like some people are using a lot of spices. You'll have to stop using spices for quite some time, because the gum depigmentation can not be effective if the gums get pigmented once again with harsh things. Like some people love to have a lot of hot beverages, like hot coffee and hot in both ways, like having the hot chilies and spicy stuff, and also like heat in itself, like coffee or some beverages which is really having a high temperature. So these things can actually increase the keratinization and melanin pigmentation in the gum, so that can cause a darker gum. See, these are the two major visibilities. Then there are other issues like gum visibility is more in some cases wherein the gum itself is, the tooth and the gum is actually coming down. If there is a lot of visibility like that, then the conventional method is to go for a orthognathic surgery to raise the whole of the maxilla up, or we do a surgical method. There are other methods in orthodontics also wherein the technology has improved, wherein we can use an implant assisted orthodontics to take the gum and the tooth upwards using implant or assisted orthodontics. But if there is a lot of this thing, then surgery is the best option. Otherwise, implant assisted orthodontics will also help you to reduce the gum visibility there. Then another reason is actually having a proclined tooth along with the gums. Then you will have to go for an orthodontic treatment. Even if you want, if it is a much more, then you can use a implant assisted orthodontics, or you can combine orthodontics and orthognathic surgery to get a visibility reduced. But that is even in centimeters we can actually reduce up to 1 centimeter. I have seen some cases being reduced to 1 centimeter of gum visibility is reduced by orthognathic surgery and orthodontics combined. So gum visibility can be corrected like that. So to know more about gum visibility, and if you have a problem like that, please comment on the channel, and then I can give you my contact and things like that. You can send me some pictures, I can give you some idea on how to reduce the gum visibility, whether it is a surgical case, whether it is an orthodontic case, whether it is a it can be treated simply by a gingivoplasty and things like that, just like removing it, as I told, is just like cuticle removal or something like that, or even we can do some of these surgical procedures which are minor inside the mouth to get this thing. The other way out is actually to increase the lip length. Actually, lip lengthening things can be done. So all these things are, most of these are surgical stuff, because we are already gone into the gums. So we will discuss all these things. If you can comment on it, on a comment this thing, and if it is a topic well worth to be displayed, we will come back with that video also soon. So please make sure that you should not be worried about gums and think that only surgery can save. There are options which are non-surgical, less traumatic and minimally invasive for gum visibility and gum discoloration. So make sure that you smile and have a great day. Thank you very much. Please make sure that you subscribe my channel and share it with all your friends who has dental problems, and also people who want to know more about dentistry. Thank you very much. Have a great day.
Wikidonis.com